Penicillin is an antibiotic or group of antibiotics produced naturally by a certain flu mold, now usually prepared synthetically and used to treat bacteria infections. Penicillin was discovered in 1928 and during the Second World War became the first antibiotic to be used by doctors. It was discovered by Scottish scientist Sir Alexander Fleming in 1928, but it was not mass-produced until the 1940s. Penicillin is sometimes used to treat tonsillitis, meningitis and pneumonia as well as other diseases.
Penicillin was discovered when Fleming noticed a mould that was stopping bacteria from growing in a petri dish. Australian scientist Howard Walter Florey made the penicillin mould into a medicine. Together with another scientist, Ernest Boris Chain, Fleming and Florey were given the Nobel Prize for Medicine in 1945. Rarely patients who are allergic to penicillin get a fever, vomit, or have a serious skin irritation. Because it's such a popular antibiotic, penicillin is the most common cause of a serious allergic reaction to a drug.
The disease-causing bacteria constantly rebuild their cell walls to protect themselves and maintain their structure. Penicillins work by penetrating and destroying these cell walls, consequently killing the bacteria cells. The following drugs may interact with penicillins: Tylenol and other medicines that relieve pain, medicine for overactive thyroid, other antibiotics, blood thinners, anti-seizure medicines, and blood pressure drugs. Some side effects of penicillin are itching, vomiting, dizziness, heartburn, rash, confusion, and abdominal pain. Penicillin antibiotics are considered safe to use during pregnancy.
Having been brought up on a farm in Scotland, scientist Alexander Fleming wasn't afraid of getting his hands dirty, examining nasty bacteria like Staphylococcus aureus, which in humans, as well as horses, can cause death, as well as vomiting and boils. One day, in 1928, Fleming came back from his holidays. He found some cultures of the Staphylococcus aureus bacteria, which he'd meant to throw away, had died. But instead of throwing them away, he stopped to think what might have caused some of his sample to die and the rest to live. After a lot of time and effort in his lab, Fleming worked out that some of his sample had been contaminated by a particular fungus, which he then managed to grow himself. As an ex-soldier in World War I, he'd seen hundreds of soldiers die due to bacterial infection, and he figured that if the fungus could kill bacteria on his bench, it might also kill bacteria in wounded soldiers. And he was right. Having renamed his mould juice penicillin, it was ready for public consumption in time for the next war on D-Day. Penicillin has saved the lives of millions of people and horses. But due to overuse, some bacteria is becoming resistant, and methicillin-resistant Staphylococcus aureus is now widespread among humans, known by its more popular name, MRSA.